United States officially completing its withdrawal from the World Health Organization, the WHO, and that comes 1 year after President Trump announced America was ending its 78-year-old commitment, with administration officials citing perceived failures of the WHO during the COVID-19 pandemic, and the president criticizing, quote, unfairly onerous payments that the United States made to be a member. Now, why is all that significant? Well, the WHO is the United Nations Specialized Health Agency. It coordinates the world's response to global health threats and disease outbreaks. It also sets guidelines for hundreds of health conditions, including the treatment of cancer. Now, breaking ties with the WHO also means that the United States is not going to participate in flu strain research and the decisions about updated flu shots. But the biggest question through all of this, how does this affect you? How does this affect your family? Joining us now to discuss that, distinguished university professor Lawrence Gostin from Georgetown Law. He's also director of the World Health Organization Collaborating Center on Global Health Law. Thank you so much for taking the time. What does it mean for the United States to withdraw from the WHO? What's going to be the impact on the United States? What's going to be the impact on the world?
Well, thank you for inviting me, Jesse. I appreciate it. This is unprecedented. The actual idea for the World Health Organization originated right here in the United States in 1945 in San Francisco. And ever since then, as you said, for 78 years since its existence, starting in 1948, Democrats and Republican presidents alike, all of them, realized that American national interest and security depended upon the World Health Organization, even with all of its flaws. Until now. And now we have a major rupture, which I think is very damaging to our national interests.
But how does that affect everyday Americans? How are their lives going to change? How is this going to impact them in the near future?
I think, if we don't get an emergency, if there's nothing that goes awry, we have pretty good scientists and pretty good public health professionals right here. I think people, I want to be honest, the public's not going to say, wake up tomorrow and say, oh my gosh, what's happened? But when there's an Ebola epidemic, coronavirus, SARS, when there's a flu pandemic or Mpox, and the United States is at the back of the line for vaccines and treatments, you're going to see a huge outbreak, an outcry.
You're saying they wouldn't help us? You're saying if that happens, we wouldn't have access to information, we wouldn't have access to treatment?
Well, the WHO has been very magnanimous. They said we're open for business. But when they do their flu surveillance meetings or measles or polio eradication, the Trump administration either doesn't show up, or it shows up and does talk, or bizarrely, it shows up and doesn't say a word. This is not normal behavior. So,
well, just to provide the counter argument here, there's the issue. They say red tape, right? So Secretary of State Marco Rubio, Health and Human Services Secretary Robert F. Kennedy Jr., they said that the U.S. right now, what they're going to do is they're going to work with other countries. They're going to work with what they say are, quote, trusted health institutions to track and fight emerging diseases. Now, of course, there'll be a question of accreditation. Can they, what are these institutions? But do you not believe that would work? You don't believe that would cut through whatever the red tape they believe is of the WHO if there's an emergency?
No, not at all.
Why?
Well, first of all, there is no red tape in the surveillance networks for influenza or measles or its global outbreak and response. But more important than that, WHO has 194 countries. Do you know how many countries we've done deals with? 11. Okay. 11. So it's almost laughable that President Trump thinks that he can do a deal with virtually every country in the world to keep America safe.
The WHO would need American funding, right? I mean, we do support a lot of it. This is a big loss to them, too.
Undoubtedly, and that's a big loss for the world and WHO. There are no winners here.
Well, isn't it also true, and we have about 30 seconds, isn't a concern the influence of other countries, Russia, China, India, if they have more of a role and more of a say, more of an influence in the WHO?
Yeah, I don't like that. I want the United States to be the leader. I want us to be the biggest influencer, the biggest funder. We're the best scientists. We've got really good heart, good values. So this is not the way the world should be. There should be a WHO, and the U.S. should be at the center of it.
All right, let's see what comes of this. There's always an option to rejoin, or as a negotiation when we talk about the president. Professor Lawrence Gostin, thank you so much for taking the time. I appreciate it.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.